From April through October 17th, the CDC now estimates 22 million people got sick in this country, 98,000 sick enough to be hospitalized, and about 3,900 died, including 540 children in the United States.
Actual, pregnant moms who I know a couple who've been waiting in line for 2 hours and they're told, sorry, we've run out. You can't get shots for yourself or for your two little toddlers, and go take your chances. It makes vivid what government-run health care will be like.
I say that there's a huge difference between Hurricane Katrina and government failure and what we're seeing here in terms of the delivery of the vaccine. This is a matter of private manufacturers not living up to promises, problems in terms of the delivery system.
We want to go back now to the H1N1 flu because the CDC is expected to put out a full report tomorrow on where the vaccine can be found. For many people, it's been a frustrating search with supply short and distribution left to a patchwork of state and local authorities. But across the ocean, Sheila McVicker tells us Britain may have a better way.
Across the United States, getting vaccinated against swine flu has meant the frustration of hours waiting online.
Thank you for waiting. You're in. Thank you.
Contrast that with this, the quiet calm of a British doctor's office, where it's vaccination by invitation only.
Of course, we have to get the highest priority patients done first.
Everyone here got a phone call from their doctor because they have an underlying medical condition. She is pregnant. He is diabetic. Jane Theophilus takes medication that depresses her immune system.
Why was getting this vaccine important to you?
It wasn't. I was told to come.
The centralisation of Britain's National Health Service, the NHS, means every at-risk person can be identified. Each NHS medical practice got 500 doses of vaccine, a first wave, to vaccinate the most vulnerable first. Dr. Steve Field is a British GP and a Harvard professor.
In the United States, I get the feeling often that it's about survival of the fittest, survival of those with money over those perhaps who don't have money. I just think the system here is much more equal for people.
There's no panic about supply because there will be plenty to go around. For years, vaccines in Europe have included additives that enable a smaller amount of vaccine to make more doses.
There will be enough vaccine, so we've now moved from an area of blind panic to almost one of complacency.
For every one vaccine dose in the US, there are 4 in the UK. Additives are not used in the US because Americans worry about their safety. After a peak early this summer, Britain has also seen the number of H1N1 cases decline. Good news, it's leading to a much more relaxed attitude. While some people are still getting very sick, for most it's a relatively mild illness. After predicting 65,000 swine flu deaths in July, Britain's government has revised its worst-case scenario death toll downwards to 1,000, and that's lower than the toll from seasonal flu. Sheila McVicker, CBS News, London.